without further ado, integrating the caregiver as a member of the multidisciplinary care team with Erin Kent, PhD, MSc, and Loretta Muss, RN, BA. So let's go ahead, and I'm just going to flash up the bio information about Dr. Kent, but we also want to say that we've got some top facts to share. Let me go ahead and share our full camera view so you can see us all. So Dr. Kent, Erin is grateful every day to work at UNC, surrounded by bright, curious, and committed individuals. She's a Cal Bear turned Tar Heel and proud of it.
Indeed.
Very good. And enjoys running, tennis, hikes with her dog, Ollie. And number one, family and community is her why for getting out of bed in the morning to do work, and for going to bed at night with a full heart. Excellent. Dr. Kent, thank you so much for being here today.
Thank you.
I'll go ahead and flash up Loretta's full, or this is a tiny part of her bio, but we'll put that up, and then if you want to go back and read that in the slides, you can. Here we go. Loretta loves what she does and truly loves and respects the many talented people she works with. I know this from years of being fortunate enough to work with her. She enjoys getting time each day for a long walk, gym, or yoga. And her family is definitely number one. Loretta, thank you so much for being with us today.
Thank you.
All right, so I mentioned Poll Everywhere. This will be our first question. What holiday was celebrated in the U.S. on February 17th? National Random Acts of Kindness Day, A. National Turnip Day, B. National Caregivers Day, C. A and C, or E, all of the above. These are generally kind of softballs. All of this is anonymous. Nothing counts against you here, but in just a minute you'll be able to see that and vote on that. While you're looking at that, here's our disclosure. Thankfully, I don't have to put you all through reading every word of that anymore.
Okay.
All right, so looks like we've got a lot of people saying National Caregivers Day, and then A and C, so Random Acts of Kindness Day, all of the above. Wow, okay, we've got 40% there.
I know.
I'm going to guess that C is a part of this. Just something makes me think that, but I don't know about the other two. How are they doing?
They're doing okay. I think they get the spirit of the question. But we've got, only one group is technically correct.
All right. Which one is that?
That would be answer D.
Answer D. All
right.
So
those of you answered C, totally, that's great, because it is National Caregivers Day. It's actually a very recently declared holiday in honor of both family caregivers and people who work as professional caregivers. It is not National Turnip Day. It's actually National Cabbage Day, which makes me feel a little bit sneaky. But it's also National Random Acts of Kindness Day. So it is both of those things. So kudos to those of you who answered either option D or C. And fortunately for my students, I don't really write multiple choice tests because I think I would be a little sneaky and stuff like that. Okay.
All right. Well, we know a little more about turnips and cabbages, but I think that's not why we're here today. So let's go ahead and without further ado, and I'll pass the mouse over it just in case you want to use the cursor for any reason.
For emphasis, will they be able to see the cursor?
Okay. They sure will. So integrating the caregiver as a member of the multidisciplinary care team. Can't wait to hear this. Dr. Kent, we'll let you take it away.
Thank you so much, Tim. This is really, for me, coming full circle because here I am sitting next to this incredible woman, this incredible person, Loretta Muss, who I saw give a talk at the American Psychosocial Oncology Society years ago, before I came to UNC, before I was even thinking about coming to UNC, and I could see the passion and the commitment to caregivers in her presentation, and it made me think, wow, that's a place I might want to work someday. So this is really, really fulfilling for me. So I'm going to set the stage. I'll go first, and then Loretta will take up and talk to you a lot about her direct experience working with caregivers over the years at our cancer hospital. But I want to make sure that we're on the same page. And so what do we mean by caregivers? Well, here we're talking about what we often refer to as family caregivers. We do really mean families of choice, families of blood, families of origin, just any individual who's assisting a family member or friend and providing care which is typically uncompensated, usually in the home setting or out of the hospital setting, but importantly involving significant efforts for an extended period of time. And that time obviously can vary, as can the effort. But the important part is they are committed, they are the last stop. And caregiving requires many demanding tasks. We'll get specific about what some of those look like. And approximately, according to some of the best estimates that we have, there's about 53 million people serving as a caregiver, an informal or family caregiver in the US. So that ends up being about 1 in 5 Americans. Now let's talk about cancer caregivers specifically. We'll start with the number of people living with a history of cancer, or for shorthand, cancer survivors. So we think there's about 18.1 million people living with a history of cancer, so from point of diagnosis forward, in the US right now. And I don't know about you all, but numbers sometimes kind of are a little too abstract. For me, it helps to think in a more relative basis. So that's the cities, the population size of the cities of the 4 biggest cities in the US. So that's New York City, Chicago, Los Angeles, and Houston. And just to give you a sense, that's far bigger, almost twice as big as the population size of North Carolina. And that number is going to continue to grow with the aging of the population, with better cancer treatments out there, earlier detection. We're going to have a larger number of people living with cancer in the years to come. Okay, so how do we get to the caregiver part? It's much harder, right? Because number one, caregiving isn't reportable the way that cancer is. And sometimes we will have one person caring for multiple care recipients, or we'll have one person with multiple caregivers. So it's not a 1-to-1 ratio. However, there's been some attempts to try to get at the prevalence of the number of caregivers. And the Health Information National Trend Survey, which is a survey that is run by the National Cancer Institute annually and has some core content and some rotating content, is a population-based survey of adults in the U.S. Who are, and the survey focuses on health information, health behaviors. They put in a caregiving module to try to get a sense of who out there is caregiving, asking the question, are you currently caring for or making healthcare decisions for someone with a medical behavioral disability or other condition? So from this survey, we find that about 15% of U.S. adults reported caregiving. So that's a slightly lower number than we found in the National Alliance for Caregiving, or Caregiving in the U.S. data, but still pretty prevalent. And you see the breakdown here. About a third are caring for parents or parents-in-law, a little less than a third for children, and about 16% for spouses or partners, and the rest for other individuals. And then it breaks down to about 2.5% saying they're only caring for an individual with cancer. So the person that they're caring for only has cancer, and that ends up being about 3 to 6 million individuals. However, this survey allowed respondents to mark as many conditions as their care recipient had. And if you think about multiple chronic conditions, or people who are living with cancer and something else, then we're talking about 16 to 19 million people. So big number. And in North Carolina, we have a survey that it's a national survey that's operated at the state level called the Behavioral Risk Factor Surveillance System, BRFIS for short. They also field a caregiving module every about 5 years, and they happen to field it in 2021. Now, I highlighted this question, parts of this question, because it's important to see that there are different ways that surveys and efforts assess caregiving. So the way that the BRFIS assesses it is during the past 30 days, did you provide regular care or assistance to a friend or a family member who has a health problem or disability? HINTS asks about current caregiving, BRFIS asked about past 30 days. Somewhat close, but not identical. And from this survey, we see that about 17.5 or 18% of people are saying that they're caregivers. Now that's for any condition. And cancer is high, but it's a little bit lower. Now remember, they had to indicate main health problem, not multiple chronic conditions, but cancer still is affecting thousands of people in the state. Okay, So let's get into to why we should be thinking about, talking about, why you're all here today to think about cancer caregivers and the unique aspects of cancer that impact families and caregivers. So number one, complexity. So in cancer, as compared to other health problems, can result in a rapid health deterioration. The treatment, as anyone who knows who's been through it or treats patients with cancer, can be multimodal, can be complex with a lot of decision making along the way. One of the hallmarks of cancer is recurrence, right? So somebody can be treated into remission, but it can come back later. And that fear of recurrence is a psychosocial aspect of cancer that not only affects patients themselves, but can also affect their family members and loved ones. Fear of complications is another one too. Young adults who are going through a cancer diagnosis had the added impact of having to deal with possible adverse consequences to their fertility, for example. So there's a lot of complexity related to cancer and its treatment. Financial toxicity has gained a lot of attention in the last decade because of how expensive it is to treat cancer. And it's true that families with an adult who has a cancer diagnosis have higher odds of medical debt and even higher odds if they have any out-of-pocket costs. We also see burden, and that can be measured in a few different ways that caregivers might experience. It can be measured in how much care for just basic activities of daily living they may be providing their care recipient. And it can also be measured in things like how many hours per week are they spending in those tasks. And we see higher levels of ADL assistance. So they're helping their loved ones with more activities, things like bathing, dressing, feeding. We also see them spending more, on average, more hours caregiving per week. So we tend to think of cancer caregiving as being very intense. We also see, and I don't have this here, but cancer caregiving tends to be more episodic because a bout with cancer may be shorter than someone who is diagnosed with a more gradually progressing chronic illness. But it's also fair to say that in the healthcare setting, we're only seeing the tip of the iceberg in terms of what caregivers are going through at home. And they're essential for the patients that they treat, right? They're helping with all of these responsibilities. So getting their loved one to the cancer center, to their outpatient treatments, coordinating all the care. We talked about multimodal therapy. There's also supportive care that requires a lot of coordination and scheduling and navigation, providing emotional support to their loved ones. And that can happen in person. It can also happen at a distance. And we also have to remember the important role of distance caregivers. Symptom medication and monitoring. It's not always clear if someone's going through cancer treatment what is a serious need to go to the emergency room, need to call the doctor symptom, or just something that needs to be managed at home. Oftentimes caregivers report having to do skilled nursing tasks, things like helping with ports and catheters, physical assistance, some of that ADL work of just helping them physically get through a day, all the house management and communication. So it's just so much. And this has an impact on all areas of life. We talked a little bit about financial, physical strain. Many caregivers do report emotional strain, the stress of cancer. And in fact, cancer caregivers, as opposed to caregivers with people with other chronic conditions, report higher levels of high emotional stress, social stress, having to feel isolated and not having enough support, and then sort of that existential threat of cancer itself. Has a lot of consequences. Many caregivers have to drop out of the labor force. They have to maybe pull back on work or even leave a job. They often have to neglect their health in service of their caregiving mission, right? So maybe reduce physical activity and exercise, poor eating habits, adverse health behaviors. We tend to see higher alcohol use among some populations of caregivers, for example. We talked about distress and then the relationship strain within families because of a disease like cancer, as well as isolation, which of course has been exacerbated by the COVID-19 pandemic. And all of this has consequences and outcomes that we see measured in their own quality of life. So we see reductions in quality of life for people who have been caregiving for a period of time. decreased capacity, so decreased capacity burnout for their ability to care. Some of this may be resonant with healthcare professionals out there watching this, that those feelings of decreased capacity and burnout. And it can, if caregivers are not properly trained, prepared, and supported and provided some respite, it can lead to poor health outcomes for patients as well. Direct services are rarely provided, unfortunately, for caregivers. This data comes from a survey that was administered to a network of community oncology sites across the U.S. called NCORE. And it was a landscape survey designed to identify services that cancer centers were offering with patients and caregivers. And what they found was that when asked about caregiver engagement services, so this was from 130 different cancer practices across the country, that only about 40% were able to identify and document caregivers. That said, about 76% did say that they used some sort of assessment tools with regard to distress for caregivers, and about 64% offered some kind of supportive care service. Now, of those blue bars, and if you look at the green, so the green bars are a subset of those who offered supportive care services. About 74% offered some sort of group psychosocial service like a support group. About 60% offered individual psychosocial behavioral services, about 47% respite care, 45% some sort of self-care class like mindfulness-based therapy or yoga, but only about 20% offered training or education classes. So we're not seeing sort of a standard level of service provided to caregivers, and we're just also not seeing a whole lot of service provided to caregivers. And then the other thing I wanted to mention too is that although this area of research has gotten less attention in the past, I think some of the studies are coming out just to show that many caregivers are reporting feelings of bias or discrimination as they go about assisting their care recipients. So a survey conducted by Cancer Care, which is an organization that advocates for and provides some supportive services to both individuals with a history of cancer and their caregivers, conducted a survey of 2,700 caregivers and found that almost half reported some sort of bias in the support that they themselves or their care recipient had received for making cancer-related decisions by their doctor or healthcare team. But the thing that I wanted to point out here is that bias could take many, many forms. So it could have been bias related to body weight or size, their age, income level, insurance type, race, gender, and you can see the other categories listed there. So lots of different kinds of bias. And that bias reports were associated with clinically high distress as measured by an anxiety and a depression measure. So these reports actually have psychological consequences for these caregivers. So I want you to think about now what kind of experiences you think that caregivers have either in the cancer hospital that you work at, or perhaps people in your own network, or perhaps even yourself have had. And if you could, I think this is Tim, I think this is a free response question, right?
It is.
So if you type into the bar and poll everywhere, so it's a different kind of question than we had before. That was multiple choice. This is a free response. We'd love to get some feedback from you all out there about what kinds of experiences you think caregivers are having.
Right. So what does a typical caregiver experience in a cancer hospital look like? And let's see, I would expect to see those coming in. And, here we go.
Oh, okay.
All right. Thank you. We've already got our first one, and I'm sure we'll see several more.
Ooh. Chaotic. Yes. Yeah. So we're seeing lots of themes about being overwhelmed or overwhelming. The fact that there are limited resources, that caregivers are often overlooked and ignored. This 24/7 comment, I think, is in reference to having to be vigilant all the time. We see anxiety and frustration. Someone listed some of the many tasks that caregivers offer in transportation, medication, symptom management, and comfort, stress. And that the focus is on the cancer patient survivor, not the family member. Lack of support. Thank you all for putting in these comments. We appreciate it. It helps us connect to you two more out there, which is great. Yeah.
Wow.
So I think what we'll do is I'm going to go ahead and, if I advance, will that end the poll?
It will.
Okay. Well, thank you for sharing your thoughts with us. What we're going to do is we're going to advance, and I'm going to advance it over to my partner here, Loretta, and she's going to tell you a little bit more about what she's witnessed and continues to work with and champion at the Cancer Hospital.
Thanks, Erin. It is absolutely a pleasure to be here, sitting next to this brilliant, beautiful woman who is my champion in caregiving. She does the research, and I have a different role, and I think we're a perfect match for each other on this one. So I'm going to talk about a typical caregiver. I watched all your responses and coming from you to me, I totally get how caregivers are feeling when they're going through this with an oncology patient. So the typical caregiver is a 53-year-old woman. She's working full-time, she has children at home, and now all out of the blue, she's now taking care of mom. 80% of our caregivers are family members, but caregivers can be next-door neighbors, family friends. They can be a partner. It can be anybody who's going to be responsible for going home with the patient. Most people do not have a choice in this role. And a lot of times it's not a gradual process. Becoming a caregiver is immediate, catastrophic, and right then and there. The balance in life is no longer existence, and these poor caregivers are torn in so many different directions. So here's your job description. An advocate. And when I talk to caregivers, I say to caregivers, you're the patient's advocate, but you're your own advocate as well. So I want you to speak up. I want you to sort of raise your hand and say, I have questions. I can have concerns. I need to be taught. So I want you to take that role and to be not aggressive, but just say, wait a minute, there's more than one person in this picture here, and I'm going home with this patient. As Erin said, you're doing so many different roles. You're managing meds, you're calling the healthcare team, you're protecting this poor person that's now a patient who's scared, and you're scared, and you're thrust into a whole new world. You're a domestic engineer, you're doing the laundry, you're doing cleaning, you're feeding, you're trying to figure out how to feed people, where to get information on that. You're the domestic engineer, you're taking care of the financials. And I gotta tell you, that's a huge job, especially if you're on Medicare or Medicaid, or you've got your insurance and you're having to take care of that. You can have volumes of paperwork at your disposal, and trying to make heads or tails of it is very, very difficult. You're the healthcare coordinator. So in other words, you're the one that's managing the visits and communicating with the healthcare team. So as we go along with this, communicating with the healthcare team is a huge role. And I often say to patients, make sure that you have availability on Epic, or you have the number of your nurse navigator or physician that you can communicate with, so that you can address your needs, but particularly the patient's needs, at one time. You know, we also see patients who are being moved from their homes into family homes. Life is no longer going to be the same, at least for a little while. So when we talk about caregivers not feeling they're well prepared for this role, we're talking about what their job is going to be at home. We're talking about changing dressings. We're talking about watching ports. We're talking about being the conduit to the healthcare team and managing side effects and managing medication. A lot of them don't feel included. And here again, I'm talking about your advocacy. Push yourself ahead a little bit. Just say, I'm the patient's caregiver and I want to be included in anything that's discussed. And yes, I do have permission from the family and the patient to do this. The length of time being a caregiver for an oncology patient, if the patient is receiving chemotherapy, it can be 39 hours a week. That's a full-time job. For someone who is an oncology patient, it's usually from 2 to 4 years. A lot happens in 2 to 4 years. Their own health was not questioned by the healthcare team, and that's very bothersome because it doesn't take but 60 seconds to look at a patient and look at the caregiver and do a quick mini assessment, particularly when the average case of a cancer diagnosis is 67. You're looking at I won't use the term geriatric. I don't like that term. You're looking at an older population, and very often that caregiver is older, and how cognitively available are they going to be to this patient? Are they going to be able to get up in the middle of the night? Are they going to have trouble navigating? So it's really important to take a look at the caregiver. If it's a daughter, find out how comfortable or uncomfortable she feels about this. And I'm so glad that somebody said invisible, because oftentimes you are very invisible. I've been a caregiver and I know exactly how you feel. And I had to speak up, and I'm very glad I did. So the caregiver journey is so difficult. You're in shock. I can't believe this is happening. How am I going to do this? I've got kids to take to piano lessons, tennis lessons. I've got my full-time job. I'm trying to get information. I don't know how to ask for help. And, I've learned doing this and in my own life that people are going to call you and they're going to say, how can I help? Well, the Resource Center has a list of 25 things that you can ask your neighbors to help with. From mowing the lawn to a tuna fish casserole that's plunked in a cooler on your front porch once a week, to walking the dog, picking up the mail, sitting with the patient so the caregiver can go do a class or run to the grocery store or get her hair cut or get a pedicure. These are things that will make all the difference in the world to someone like that. Seek support. At the Resource Center here, we have a tremendous group of people called the Comprehensive Cancer Support Team. And the Resource Center can refer you to support there. So many of our programs that are for patients also include caregivers. So don't hesitate to speak up. I want you to feel part of the team that's caring for the cancer patient. You're the one that's going home. So you need to be there. You need to be designated. I believe in Epic we now have a sort of a heading that says who the caregiver is for this particular patient. And as Erin so aptly said, depression, diet, exercise, they all go down the tubes. And the high rates of depression and the loneliness is absolutely huge. So current approaches for integrating caregivers. So honestly, I'm going to tell you that when I actually coordinated advisory council for the cancer hospital, and I have two fabulous gentlemen on there. And one was a caregiver for his best friend and the other for his wife. And they approached me and they said, Loretta, what are you doing for caregivers? And I looked at them like they had two heads. And then they started talking. And I started listening. And I started learning. And I thought, this is a huge part of the care that we provide to our patients. but what are we doing for the people who drive miles to get here, stay up late, preparing special meals, monitoring Foley's? God only knows. What are we doing? So I put together a focus group, including quite a number of our advisors from the Patient and Family Advisory Council. And we came up with a plan, and we decided we needed to start small, because if we put too many things together, we were doomed to fail. So we decided to start a support group. We decided to do it twice a month, and on a Tuesday and a Thursday. And that was confusing. We also decided that if we baked it, they will come. And that kind of worked for a little bit too. And then we got lucky and we were able to offer it once a week on Tuesday afternoons. And our facilitators were social workers, the chaplain, psychologists, and counselors. And it worked very well. So then COVID came and we had to stop everything. Now we're back in person, and I've discovered that I don't need to bake it in order to come. What I do need to do is make that personal connection with the caregiver, to talk to them, and then I go back up and I bring them down to the group, because there is no time limits when you're a caregiver and an inpatient. It just sort of 1 hour goes into the next, and it's kind of a black hole. So we've got the support group going. We've probably had over 2,500 in the past 10 years that we've been doing this to attend these meetings. I will say on an average, we have 6 to 8 people come to the meetings every Tuesday. As they leave, we ask them how it was, and they will say, I am so glad I came to this. And as you will see an example of why they're so glad at the end of this conversation. I've got some folks who are going to be rounding, and they are volunteers, and they do a great job in talking to patients and including caregivers. We're teaching to the hospital staff. They're getting to know the people who are coming around to round up caregivers, to really embrace them, to explain support services just particularly to caregivers. We are also teaching to new hires, to the fellows, to the new nursing staff. They all know who we are and what we're doing. We have champions in the healthcare system, and I'm sitting next to one of the best. We're partnering with this, and we got a grant from the Capstone, with Capstone students from the School of Public Health, and we developed a website, which is a great, huge help and a source of incredible information. So the current programs that we've got here are the Resource Center. When I round upstairs on the inpatient, I will say 85% of our patients and caregivers don't know about the Resource Center.
Yeah.
They think it's a library. Mm-hmm. They have no clue where it's located. And I will tell you, this Resource Center is just absolutely a gold mine for information. So when you're at the cancer hospital here, do take the time to go down to the Resource Center. Talk to people down there. They can help you navigate this. There's everything down there that you need, from legal documents to nutrition, to a caregiving guide, to a cup of coffee, a warm shoulder. It just is one of the best places in this hospital to get the support that you need. So we're driving that home, and we do it by our rounding. Mm-hmm. We've also started this program called Living with Dying. And one of our advisors, she's a patient here, and she's between palliative care and hospice. And she said, I'm done, but there's nothing here for me to sort of look to for support. So we put together a team that included the same number of advisors as staff members, which included social workers, the chaplain, nursing. And we put together this wonderful Living with Dying seminar that was all done remotely. This is with patients who needed to talk and learn about things such as financial issues, how to talk to your family, how to get things ready, when's the time to call the physician, and palliative care and hospice. And it was it was attended by about 6 people, and it was so well received that we're now including the caregiver into it, and including much more information that is pertinent to the entire family as opposed to just the patient here. Our lay navigators and our nurse navigators they are constantly changing, but we are constantly updating on what a caregiver stands for, what they need, and how we can get them their help that they need. And occasionally they actually will come to me and I'll go up and I will talk to the caregiver. So I'm the point person. Our caregiver conversations, as I said, are meeting once a week now, and 2,500 caregivers have come. So I think that's pretty good. So the inpatient caregiver is a little different than the outpatient caregiver, because they've got lots and lots and lots of time. And as I said, it's a black hole, but nobody knows the patient better. And my husband has often said to me, if I'm ever admitted, I don't want you to leave, and if you're admitted, I won't leave you. And I find that with caregivers, that's exactly, because nobody knows me better than my sweet husband. And I hope I know him as well. So we are hesitant to leave, and I have to understand that with the caregiver. But I also explain to the caregiver that the staff knows that at 2:00 on this particular day, we are having a support group, and they're going to be hyper-vigilant for your patient, so we can take care of you at that time. I would like to see the designated caregiver's name on the whiteboard. We're certainly working on that. The staff knows who I am. I understand their hesitancy to leave, but I want to make sure that they know about the support and the resources that are available to them, because what's good for the patient is also good for the caregiver. So our outpatient caregivers, there's also the loneliness because they're afraid again to leave the patient. We want to teach them, your realtor will say location, 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 and I'm going to tell you it's education, education, education. And one of the most brilliant examples of that was one of my advisors was with a complication due to his illness. And his surgeon was there, as was his wife, and he was going home with a chest tube. And the surgeon was demonstrated how Carol was going to take care of the patient when she got home. And the physician demonstrated this procedure, how to drain the chest tube. And poor Carol, she's the deer in the headlights. And then the physician said, no, Carol, you're doing it, and I'm going to watch you do it. And I'm going to make sure that you're comfortable before I leave today. And she was so astonished for this level of support and understanding that it was a whole new aspect of caring for her beloved husband. So I want to make sure that every physician, every team member, every staff member knows that you as the caregiver are the contact information person, and that can go on Epic. Please sign up for my chart and get that information there. You can go in and you can relay information about the patient. This is so important, and this is a great way to establish communication. So my stories are rather poignant. I'm going to talk about a very young caregiver. As I was rounding on Tuesday, I went into this room and this young woman was in there, and her mom was the patient, and she was Spanish speaking. So this young woman was charged with being her interpreter. And I asked her if she would come to the caregiver meeting. She said, absolutely. So when I went to pick her up, we started talking, and I said, you're young for this group. And she said, yeah. And I said, can I ask you how old you are? And she said, I'm 16. I said, okay. I think we can work with this. I said, there'll be some older folks in there, but they're going to take you under their wings. And we went into the group, and the facilitator there was one of our social workers. And during the meeting, she came out to me and she said that this young girl was 16 and she was suicidal because it was so overwhelming to care for her mother, to do her schoolwork, to go home and take care of siblings. and she was almost at her wit's end. We got her the help she needed. She's doing well today. And if it hadn't been for that meeting, I don't know how she would have been able to communicate this. So I'm so grateful. The overwhelmed caregiver. There was a young woman, a little older than 16. She was probably in her early 30s with a real high-powered job and 2 children. And her husband got diagnosed with leukemia, which meant he was going to be in the hospital for at least 4 to 6 weeks. There was a bunch of caregivers in that meeting, including 2 young men. And they had been in the armed services. And this young woman said, I don't know what to do. My mother-in-law's coming. I got 2 kids. I'm trying to do some work. And I'm worried that my house is not going to be clean enough or there's not going to be any food or anything. And these 2 guys looked at one another and they kind of nudged each other and they said, here's what you do. You put all the cleaning fluids that you need on the kitchen counter and anything she might need. And just say, Mom, if you could help me clean the house, I would be so grateful. And she did. And it worked. And they were a team caring for the son and the husband. The long-haul caregiver was a gentleman I met that actually requested to come to the meeting. And I had some time, so I went up. And she was in a different area of the hospital. And he came to the meeting, and his wife had a terrible pelvic tumor. And I got to know this man, and I got to know him. He was very professional. He adored his wife of almost 50 years. He had 2 children, and he loved woodworking. My husband is a woodworker. We started connecting. And he came to the woodworking, he came to the caregiver group, and he met my husband. And they had a discussion about things that didn't involve cancer. And one day he was just exhausted. And I went up to see him, and I brought him down to the resource center. And the director of the resource center kind of looked at him with me, and we said, we are your moms today. This is what we're going to do. First, you're going to take a nap. Then we're going to bring you lunch. And then you're coming to the caregiver group. And he did all of those because I had my mom's hat on. And the long and the short of it is, there was a man at that group who lived in the same town that this man did. And every week thereafter, they got together for lunch to discuss this. They were each other's best support. Wow. So we're still working. We're still going to do better things. We handed out lunches to all the caregivers on National Caregiver Day.
Nice.
We have bags for orientation to new caregivers. We are doing the best we can to include them in everything that we do. For the caregivers who are watching, please know how much we appreciate you, how much you do, and we're there for you. Send up that white flag. Thanks.
Thanks, Loretta. So I have a few more slides to talk about some additional research that we're doing on caregiving. I want to sort of tell you all about how we are trying to conceptualize the very real dimensions of social support that Loretta referenced in her stories of these different kinds of caregivers, and how part of what we think needs to happen and is starting to happen is for us to think more broadly about how to support caregivers. So with partnership from Dr. Maya Reblin at the University of Vermont, we're using a tool called eco-mapping, which comes to us from social work. And what it does is it helps dimensionalize who in someone's life provides different forms of support, right? Because you go to different people for different things. You might go to someone who spends a lot of time on the computer for help finding information on a particular topic. That's a form of support. You might go to someone to ask, hey, you know, I'm swamped at work or I'm swamped caregiving. Can you pick up my kids after school today? That's a form of logistical or another form of support. You might ask for someone to just go take a walk with you and listen to you talk about your feelings, or if you're going through a hard time, maybe for the stress of caregiving, that can be a form of emotional support. So that's how eco-mapping helps us think about support in a different way and who we might go to. And what Dr. Revlin did was she developed a tool that helps us map out who might provide a support in these different domains. She's been studying the development of this program called the Social Network Assessment Program, or eSNAP, in caregivers of individuals with neurocancers. And what she's found already is that there's been very positive receptivity to this intervention, or high acceptability, and it's been very feasible to implement. So what we decided to do here at UNC was take this neuro-oncology developed social support program for caregivers and adapt it for caregivers of all different kinds of cancers, but with a focus of caregivers in the rural setting. And here is why. About 40% of our population is rural, and about a quarter of our state lives in one of our 54 rural counties. We also expect, in addition to expecting more cancer prevalence over time, we expect a higher rate of increase of cancer in individuals who live in rural areas. And we know from other research that our community outreach and engagement core has conducted that rural North Carolinians face greater challenges when we look at poverty, educational attainment, and access to broadband, which of course is so critical in our increasingly technologically mediated world. We did some formative work this is myself and my partner, Dr. Lisa Park, who's part of the Comprehensive Cancer Support Program that Loretta mentioned, and our students conducted some individual interviews with caregivers. And what we found for caregivers of rural cancer patients, a lot of untapped, unmet social needs. So we saw needs related to issues with transportation, issues with who can actually work and travel sometimes 2, 3, 4 hours to the cancer center to get their loved one to treatment. At the flip side, we saw a lot of resilience and persistence. So we had one caregiver say that they've already told their care recipient that no matter what, they take her, if they had to drive 5 or 6 hours one way, take her to the cancer hospital because that's the place that knows her and knows her situation. And then finally, we saw a lot of caregiver stoicism, which is something that we find in other research is more prevalent in individuals who are living in rural areas, and sort of a forced stoicism, right? Because there often aren't the same kind of resources that we have in more metropolitan areas. So you see here this caregiver saying there's county stuff that offers help and everything, but to be honest, the good Lord has just helped us and got us through so much, so we haven't pushed it to ask for extra. So we wanted to apply the design that Dr. Revlin had come up with for this social mapping tool, but we wanted to try to adapt it to our population. So what we came up with was a program called Encompass, or Encompass Carolina, which is a coach-assisted program that uses eco-mapping, but then also has sessions, one-on-one sessions with a caregiver coach to actually try to get caregivers to realize the value of support seeking from multiple persons. So what we're doing now is we're adapting eSNAP to Encompass. We changed the categories of support a little bit to better accommodate our population. We changed emotional support. We expanded it to both emotional and spiritual support, given that so many of our interviewees referenced the power of their communities of faith and their spiritual beliefs. And we also wanted to break apart in-home hands-on support with in-home and transportation, because we felt that for some people, they might tap into part of their social network to actually come into their home and provide that hands-on support. But there are other individuals who might be good for delivering meals, picking up meds from pharmacy, and whatnot. We have 8 different topics that are covered over these sessions with the coach, including getting social support, problem solving, growing a social support network, asking for help, finding time to take care of yourself, setting limits and dealing with unhelpful support, remembering to set and maintain boundaries, really thinking about the positive sides of caregiving, and then planning for the future. We're going to be measuring, this is a busy slide, but what it shows you is that we're going to be measuring some of the outcomes that you can see listed on the bottom here in a set of about 75 patient and caregiver dyads. So we're targeting what we call coping self-efficacy, which is being able to really do well with problem solving during this time. We're also looking at distress and caregiver burden. But the main part of this next phase is to assess whether or not this intervention is feasible to implement in our cancer hospital. I'm going to skip ahead for this part because I want to make sure that we have time to ask and answer questions. So pardon me for the fast scroll, but we wanted to know what kinds of things come to mind when you think of caregivers that you have encountered in healthcare. So if you can actually go back to Pull Everywhere and think about additional adjectives that come to mind. We talked about this a little bit before with overwhelm and anxiety. Maybe there's some additional things that you might have thought about.
Great.
Hero.
I believe we have this set up as a word cloud. So if more than one person reflects the same word, resilient, you can already see the effect there.
That's great.
Love the way people are jumping right in
Yeah, they
and
really
responding
are.
to this. Thank you so much.
These are very, very positive words, and it's great to see. So there is this flip side, right, to encountering a very stressful situation like a cancer diagnosis in a loved one, and that it really tests our limits. But it's just amazing to think about and see all the evidence of everyday heroism in the halls of our cancer center. Thank you. And in fact, our research team conducted some listening sessions with caregivers across the state. These were caregivers who were caring for loved ones with all kinds of conditions, including cancer, but also dementia and other chronic illnesses. And if you look at the top right corner of the page, you see a little word cloud. This is caregivers describing themselves. We asked them to first describe hardest and best parts of caregiving, but then we said, in a word, how would you describe yourself? And you see kind of a combination of words, right? Determined and patient, persistent. You also see some of the earlier words of inadequate, anxious, and overwhelmed. So this just shows that seeking support and receiving support is part of strength. It's about actually maximizing our potential to do the most important kind of job there is out there, which is taking care of one another. We also asked people, though, to help us understand what parts of the service, long-term service and support system might be helping them conduct their role as a caregiver, and what might be hindering them. And you can see some of these quotes here, right? So the things that I need simply aren't available because they're not profitable. We need day programs, and we need respite, better pay for healthcare workers and home health. We need some sort of a public service campaign to take away stigma related to asking for help. So these were directly from the voices of caregivers that we listened to over the summer. I'm happy to say that caregiving is gaining national attention. There's an act called RAISE, which is Recognize, Assist, Include, Support, Engage, Family Caregiving Act. Its report to Congress last fall included these 5 areas of increasing support for caregivers, with the final thing being generating better research and more data to provide more evidence-informed practice. So our teams are working on this, but I also want to draw attention to everybody that we really need to be engaging family caregivers as partners in the cancer center and in our clinical spaces. Okay, this is our last Poll Everywhere question. I'm curious if we'll let this go for about 15 seconds, but the month of November is also set aside to honor caregivers, so the whole month. Let's see. So who do you think might have proclaimed November as National Caregivers Month? I'm sure, let's see. Let's just go for I'm watching this counter here. We'll let it go for 5 more seconds.
All right.
Well, everyone who said option D is right. It was President Clinton. And that's our last slide. And it's just a note to say, and of course, we do want to end on a positive because I think there's a lot we can do for caregivers. But the truth is, with the changing demographics of our country and most countries out there, we are going to have fewer caregivers available simply through the aging of our population in the future. So we have to. We are without choice in this. We have to think about creative ways and innovative solutions to support caregivers because it's going to affect all of us. And that's it.
Wow.
I think we maybe have time for like one or two questions.
That's
Tim.
amazing. Do you mind advancing that one more? There we go. And I'll go ahead and start. We already have some questions coming in, and those should show up on the screen in just a minute. There we go. Is this caregiver support group open to caregivers for patients who do not have cancer?
No, I wish it were. We're trying to replicate it in other areas, but only in oncology thus far.
There are additional support groups out there, though, within our state that might be able to meet the needs because there are a number of virtual support groups out there.
All right. Is the list of 25 ways to ask for help online?
No.
But
You'd have to contact me and I'd be happy to send it to you.
All right. And
Thanks, Loretta.
if that's something that's available to be shared, we could certainly post that on the site as well.
Good idea.
Okay, that sounds great. Boy, these questions just keep rolling in. Let's see. Why less caregivers in the future?
yeah, that's a good question. I think it's mostly given the demographics of the population. So this isn't necessarily specific to cancer, although we are seeing an increase in prevalence. But it's just the fact that if we look at the number of the birth rates are declining and people are living longer. So most people in their later years in life need some form of informal support, and there's just going to be fewer younger adults to be available to provide that support.
Great. Let me ask, I've got one, and I can't believe you all covered so much material in this hour. It's flown by, but just a wealth of information. Thank you both. But for somebody at another setting looking to emulate some of the things that have been done here, what advice would you give to them?
There are a lot of online resources. Again, we can provide links, but the National Alliance for Caregiving puts out all kinds of resources for both healthcare providers, for individuals who are caregiving to either help better manage their own caregiving situation or set up different kinds of programs. It does take championing. It does take some political will, but a support group, we keep hearing that is so many caregivers want to not feel alone. They want to be able to talk to people that are currently going through it and be able to problem solve together. So that's probably one of the biggest things that can be done.
And here's one last question. We're going to make this the last one because we are coming down to the end of our time.
Do we think that caregivers get counseling I think through or different levels of counseling, right?
Yeah. So if the patient is in treatment, and please know that we are very short-staffed, the Comprehensive Cancer Support Program should be able to refer a caregiver who does need some assistance in this area. We'll get you the help.
Great. Would you mind passing me the keyboard? I'm just going to advance to a few more slides. Whoops. Sorry about the beeps there. We do want to say our thank yous. So we want to thank the people of North Carolina for their generous support of what we do through the University Cancer Research Fund and the UNC Lineberger Comprehensive Cancer Center. We want to thank the team here at UNC-LCN, Benny Obore and John Powell, Oliver Marth, Andrew Dodson, Nadja Brown, Patrick Muscarella. Each of them puts in a lot of work to make these things possible. We want